It's called Enterovirus D68, and although there's only been 97 confirmed cases, officials say it could be just the beginning of a major outbreak, and experts predict we could see some cases in San Diego within the next week. Joining me now is Dr. Mitchel Goldman from UCSD, as he does every Tuesday, to talk about this outbreak. Thanks for being here.
It's good to be here, Kath.
It's now spread to 12 states. It's something of a rare virus. What is it exactly, though?
You know, it's called an enterovirus, which means it really lives in your intestines. But it can cause things like the common cold, and it's spread like almost all viruses through coughing and sneezing and bodily fluids. And that's why it's so important that we really teach the kids how to wash their hands. But what makes this one different is that unlike normal types of viruses, this one gives you a really bad cold. And kids that have asthma or other breathing problems can really get sick from it and can even be hospitalized.
Let's talk about the symptoms. What are they, and how can we watch out for them and distinguish them from your typical cold?
It's actually really difficult. The symptoms are normal, like we would see in a cold: coughing, difficulty breathing, but sometimes you get wheezing. You almost can produce an asthma-like effect, and that's what makes it a little bit different. But sometimes you don't even get a fever, so it's just like getting a cold without the aches and pains, maybe a little more wheezing. And the key most important thing is, if you think your child is having trouble breathing or is breathing rapidly, that's when you got to get them to the hospital or an urgent care center, because that's when things can go bad. Now, the good news is this virus only lasts for about 5 to 7 days. So far, no one has been killed, there's no deaths, but a few children actually have been into the intensive care unit to help with the breathing disorders.
And it doesn't respond to antibiotics. There isn't a vaccine, so how is it treated?
You know, you just treat it like any kind of breathing disorders. You just keep the kids really comfortable. You can do breathing types of treatments to open up their lungs and allow them to breathe better. A little bit of oxygen never can hurt, keeping them hydrated, but that's for the hospital to do. When the kids are at home, if they're not having really difficult time breathing, basically just have them relax, not a lot of exercise, keep them high on fluids, and they'll do just fine. But it does take about 5 days, at the most 7, for it to clear. And again, most important thing, teach the kids how to wash their hands for 20 seconds. Sing the happy birthday song, and that'll get them to wash their hands about 20 seconds, and that's the best way to help prevent this from spreading.
All right, Dr. G, thank you for sounding the alarm and bringing this to our attention. Cases could hit San Diego as early as next week. Thanks for being here.
Good to be here.